Chemical skin peels are by far one of my favorite treatments to do, and the reason for this is because they can bring about such amazing results, harnessing your skin's own power of healing. But there is such a range of chemical peels out there. A chemical or a skin peel involves using an acid that helps to exfoliate the skin in the deeper layers, leading to a period of where you might see some skin peeling or flakiness before it strengthens and becomes brighter and more hydrated. That peeling period can vary so much depending on what type of peel and chemical you use. Now, you might find a lot of these chemicals already present in cosmetic skincare products, which you can buy from the shelf. However, the strengths used in a professional setting will lead to much more drastic results, especially if we're using it targeted for a particular reason. Now, let me go through a little bit of the differences between the different peels. So, you can have peels that are going to target just the superficial layer of skin, or the layers in between, or in the middle, or the medium depth, or even much, much deeper. And in order to do this, it depends on not just the acid used, not just the concentration, but also what's mixed in with it and the level of intensity of the acid or the pH. So, for a superficial peel, you can get really, really mild peeling. You might get a little bit of dryness between day 2 and day 5, but nothing that anybody would notice on you. And then your skin becomes really hydrated as it heals and repairs itself. A medium peel, this is where you might see a little bit more peeling. You might actually get a flakiness at this point. And then with a deep peel, that's where you get a lot stronger peeling, and where some people describe it as a lot of redness with a lot of peeling. A deep peel may take 2 weeks to recover from, and it's important to factor that in when you're booking this in. The other thing to mention is the type of acid. So, whilst I've discussed the layers that this can penetrate, the superficial, medium, and deep layers, the type of acid can also affect the downtime and the result that you'll get. For example, salicylic acid is great for those with oily skin, and it can penetrate a little bit deeper with those with oily skin. Mandelic acid comes from almonds, and it's a really mild peel that, used at the right way, can be great for all skin types, particularly darker skin types where you're a little bit more careful with having chemical peels. Then there is glycolic, a universal exfoliant that is used in lots of skincare products, but also as a strong chemical peel because it's very effective at removing the top layer of skin. One of my favorite peels to use is TCA. TCA is phenomenal at renewing and making the skin a lot healthier, but this works slightly differently from the other acids. This works by completely destroying some of the skin tissue, what we call keratocoagulation, and leads to a form of significant healing. It can be used to take away dark pigmentation marks, and it can be used to resurface acne scarring. This can be found as a standalone TCA chemical peel, but it can also be used in combination with other chemicals, such as in the Perfect Peel, where they combine TCA with salicylic, amongst other ingredients. Chemical peels are one of my favorite treatments to do, and the reason for this is because there's such a variety out there and they bring about such amazing results. All of us are different and our skin types are different. Everything from our skin color to the oiliness of our skin and also the age of our skin. This requires different chemical peels in order to get different and tailored results. So, you have superficial peels, medium peels, and deep peels, and you have a wide range of different acids. A superficial peel is great for those that want absolutely minimal downtime, but they still want the benefits that the acid brings about in the changes to their skin. A medium peel is what the majority would go for in a professional setting, and this gives you maybe a little bit of flakiness, a little bit of dryness in the first week before the skin heals and looks brighter and healthier. Whereas a deep peel, you will notice more significant peeling, and the healing may take over place at around 2 to 4 weeks. And that's when you get a lot healthier, stronger, resilient skin, which probably continues to get healthier over a period of 3 to 6 months following a deep peel. And there's such a range of different acids out there, from salicylic, mandelic, glycolic, These acids can be used to target different skin types. So, for example, salicylic is great to target those with oily skin and those with breakouts. Azelaic acid is perfect for those with redness, similar to lactic. Those with sensitive skin or dry skin, lactic actually boosts the hydration in our skin. Mandelic can be even used in darker skin types to bring about healthier and rejuvenated skin. By far, one of my favorite acids to use is TCA. This is a deep peel, and this can be combined with other deep peels such as phenol or even salicylic acid. This brings about results where you can get rid of stubborn pigmentation marks as well as resurfacing acne scarring or deep lines and wrinkles. In order to learn more about chemical peel, it's really important to book a consultation so we can assess your skin and find out which one will be most suitable for you. Suitability is not just about your skin type, but also what downtime you're able to have. And we'll take this into consideration in order to ensure that we bring about not only the best result for you, but one that you can tolerate.